Cats are not big water drinkers, they need half as much water as dogs per pound of body weight. So when you notice your cat drinking a lot of water, or maybe even downing it and begging for more, it may be a red flag. How much water is too much? What causes your cat to drink so much water? And, more importantly, what should you do about it? Watch the video for answers. Cats typically drink 18 to 27 ml of water per pound of body weight per day. An average 10-pound cat drinks approximately 180 to 270 ml of water per day, which is equivalent to around 3/4 to 1 cup of water each day. Each individual cat will vary in how much water they need to drink, and what is normal for your cat may fall a little outside this range. Factors that could alter how much water is required include diet. Canned cat food has water content already, so your cat will drink a little less if they eat a wet food. Also, diets high in sodium require more water. Environment. Warmer months or higher humidity require more water to stay hydrated, especially if your cat is active. Age. Very young cats drink more than adults. Young kittens under 8 weeks of age require as much as 80 ml of water per pound of body weight. Health. If your cat has a medical condition, she may need to drink more water to stay hydrated. Medications. Certain medications increase thirst and/or urine output in cats. Try measuring out the amount of water you put in the bowl each morning. The next morning, measure how much is left, wait until 24 hours have passed. Be sure to never limit the amount of water your cat wishes to drink. She must always have access to as much water as she wants. Cats drinking water. How much is too much? Polydipsia is the condition of a cat drinking too much water. It is usually caused by polyuria, meaning your cat's body is producing more urine and needs more water to do so. Shorthand for these two cat health conditions is POOPD. Cats vary in how much water they drink day to day. If your kitty is particularly thirsty one day, maybe due to running around on a hot summer day, the next day her drinking would be less. This would be normal variation and no reason to worry. But if your cat is consistently, each day, drinking more than 45 ml per pound of body weight per day, she likely has polydipsia. A 10-pound cat would need to drink more than 450 ml of water per day to have polydipsia, or about 2 cups. You may not notice a subtle increase in your cat's water drinking, but look for signs like waiting by the water bowl for more, meowing until it's refilled, drinking an entire water bowl or most of one in one sitting, larger volume of urine in the cat litter box, bigger clumps and/or higher number of them, urine outside of the cat litter box. Why is my cat drinking a lot of water? Common causes. There are many health reasons cats will drink too much water and be diagnosed with polydipsia. The 3 most common causes include chronic kidney disease. Around 1 to 3% of all cats have chronic kidney disease. Over time, kidneys become more and more damaged. Kidneys are partly responsible for maintaining your cat's balance of water, and when kidneys are damaged, they cannot hold on to water like they should. All the water goes into the urine instead. This makes your cat increasingly thirsty. Hyperthyroidism. Up to 11% of older cats are diagnosed with hyperthyroidism. The thyroid gland produces thyroid hormone, which is responsible for growth, metabolism, and impacts the brain. When the gland produces too much hormone, metabolism becomes really high and the effect on the brain can cause changes in behavior. When metabolism increases, so does thirst. Also, thyroid hormone blocks antidiuretic hormone, AD, from interacting with the kidneys. This hormone allows the kidneys to keep water in the body and not put water into the urine. If AD cannot interact with the kidneys, a lot of urine and thirst occur. Diabetes mellitus. Around 0.5% of all cats have diabetes mellitus. Diabetes mellitus occurs when your cat does not have enough insulin. Insulin allows blood sugar, glucose, to enter the liver, muscle, and fat and provide energy. If there is not enough insulin, glucose gets increasingly high with nowhere to go. The kidneys push glucose into the urine, and through osmosis, water follows glucose to dilute the urine. Since your cat produces too much urine to rid the body of glucose, she becomes very thirsty. If your cat is consistently drinking more than 45 ml of water per pound of body weight each day, or if you notice any other signs such as decreased activity, increased appetite, and decreased weight, you should bring your cat to the veterinarian as soon as possible.